Wednesday. It's time for PT. All right, so we're gonna work on a little hip strength today, okay? And we're gonna use the TheraBand brand band. TheraBands, they're great. I love the green or the blue for this one, but if your hips are really weak, red or yellow is a great color to use as well. Okay, so we're going to lie on your back. And actually, you're gonna do this, start with it sort of sitting if you can. Your legs can be straight, that's fine. You're gonna take your band, right? Knees a little bit apart, right? Not real close together, a little bit apart. And you're gonna tie a bow. I find that the bow is the easiest, right? Slide that guy down, do a loop and swoop, and there we go. We got a band, okay? Let's tie it around. I like to flatten out the edges of the band just so it doesn't cause any sort of additional discomfort. And really we're kind of hitting right at that knee joint or even slightly above, okay? Because the move is we are going to, sorry, you're gonna get, let's see the best angle here, right? Oh, okay, so we're gonna do, feet are close-ish together, right? They're touching each other. And you're gonna go from here out, okay? And what you're trying to think about is a lot of times when I see people do this, there is a, oh, I'm going out, but look, my right leg's doing a lot more than my left. So what I want you to do is we're gonna do this two different ways. One is both knees out, slow and controlled. You control the band, doesn't control you. Slow and controlled, out and together, right? That's not the move. Now, the next one you're gonna do is you're gonna have your feet a little bit further apart. I'm gonna change this direction. Sorry, I don't like this angle, but it helps, okay? Okay, so we've just done this, okay? Now, feet are a little bit apart, and what I want you to do is you're gonna keep one leg stationary. So this knee is gonna come out just a little. So we're starting with a little tension on the band. Now, it's gonna stay here. It's not gonna do anything. It's just staying nice and stationary, and from there you're gonna pull out. Now, we're not lifting, your back and your butt are staying down. This is hip moving, okay? So we're coming out and back. So what's happening is you're stabilizing with this leg and getting a little bit of stabilization strength in there while you're doing the external rotation of this hip. Sorry, puppy. Okay, you're gonna do 10 of those. And then you're gonna switch and you're gonna stabilize with this knee and come out with the other. Okay, now, the key thing here is this movement of what is happening in your low back, right? So this movement should all be just your thighs moving, right? Like there shouldn't be, I'm doing this, right? Like things should not be moving around, right? You are keeping your low back and your pelvis nice and stationary, and the movement is just happening from your hips. If you start to feel like you've got to lift off or things are moving, then keep that movement a little bit smaller and focus on it being your thigh moving and that hip rotating rather than you lifting your hip or moving your pelvis at all, okay? So that is the focus of these guys, is just to try and have it be a focused move and that they're both kind of doing the same amount of work, okay? It's a great strengthener for your hips. Get some glutes in there as well. And anyway, enjoy. Have a great Wednesday. Bye.